I would say that as far as scoring goes, the great thing about the PCL-5 is that it can provide information on both PTSD symptom severity and probable diagnostic status. It's worth noting that it can't provide definitive information about diagnostic status because only a clinical interview can be used for that. But probable diagnostic status can be used, can be determined by the PCL-5, and there are two different ways to do that. The first is the DSM scoring method. This uses the DSM algorithm. So the DSM algorithm for the symptoms of PTSD say that in order to meet for PTSD, you have to have met for at least one re-experiencing symptom. Those are the B symptoms. At least one avoidance symptom. Those are the C symptoms. At least two of the D symptoms, which are negative alterations to cognition and mood, and two of the E symptoms, which are hyperarousal symptoms. Now, because the PCL-5 corresponds to all of those 20 items, you can just look and make sure that a participant or a patient has a 2 or greater for at least one of items 1 through 5, which corresponds to B, 1 for 6 or 7, which corresponds to C, 2 for 8 to 14, which corresponds to criterion D, and 2 for 15 to 20, which corresponds to E. And that will, again, give you a gauge of probable PTSD. The other scoring method is the cut score method. And generally, this involves adding up all of the items on the PCL-5 that the participant has answered 1 through 20, and then using a cut score to determine if that total score is above or below the cut score, in which case they would or would not have probable PTSD. There have been a lot of different studies that have validated the PCL-5 and tried to determine cut scores. And what we know about cut scores is that they are really contingent upon a lot of different factors, including the sample that you're looking at, the language that it's in, the clinical interview you're using. But in general, we have found that scores of 31 to 33 work as a pretty decent cut score for a range of different populations. Although we do really discourage folks from reifying that and encourage the use of clinical judgment because it's only going to give you probable diagnostic status.